The Victorian Government has released a landmark report into women's pain, the first of its kind in Australia. It found 90% of the 13,000 respondents had experienced pain which lasted for more than a year, with a third saying they were in constant pain. Sally Hassler is the CEO of Women's Health Victoria and was on the advisory panel for this inquiry. She joins me now from Melbourne. Hi there, Sally. Thank you so much for your time this morning.
Thanks for having me.
There are some stories in this report of women reporting feeling gaslit and dismissed, told to seek psychiatric help for repeatedly reporting physical pain. Do these stories surprise you?
Well, the report tells us what women have been saying for years. It confronts centuries of bias that has been built into the health system. But what's important is this is a really significant moment that we need to act on. Those thousands of women that have come forward and shared their stories deserve a response that really addresses the structural inequity that is built into the healthcare system. The report shows that those 95 of the people that responded, 95% of women sought assistance for their pain. But as you said, Mel, 71% of those women reported feeling ignored or dismissed.
And this report, which is, as we've said, is the first of its kind in Australia, it sort of goes beyond just pain, right? It's also found a string of issues relating to the fact that a lot of what we know about medicine, as you sort of touched on there, is based on Caucasian male biology. Can you take us through what that means and what the impact of that has been?
Well, absolutely. Like I said, it is based on a health system that has baked in gender bias, and that affects the way that medicine is understood and the way that symptoms are managed. That bias reflects the way that health professionals are educated and trained to provide care. And it also reflects the way that healthcare is funded and the way the health system operates. And so that broader inequity impacts on individuals' experiences of care. And we know at Women's Health Victoria that sex and gender impacts healthcare, and that if we don't specifically design care that reflects the bias and inequity that people experience, then unfortunately and tragically, as you've seen through the courageous stories in this report, it can lead to worse health outcomes.
Another thing which struck me in this report was the women in regional and remote areas. Of course, we know, face the obvious barrier of additional time and distance to actually seek help. But can you take us through some of the particular challenges faced by women outside of major centres when it comes to seeking help?
Yeah, this report is a really important opportunity to listen to rural and regional voices. 41% of respondents live in rural and regional areas, and they reported additional barriers to care. So longer wait times for a GP, higher cost barriers, like you said, needing to travel for care, or maybe an unavailability of care of healthcare providers in their area. So, for example, one of the respondents to the report shared that she had been to her GP experiencing pain, and her GP had recommended that she see a gynaecologist, but there's no gynaecologist in her area, and she needed to travel hundreds of kilometres to Melbourne to access that care. And we saw last week, for example, through the release of the Healthy Women, Healthy Gippsland report, that women living in Gippsland, as an example, are more likely to be diagnosed with cancer and tragically more likely to die. And so it shows that geography compounds with those experiences of gender inequality to really provide additional barriers to care, which makes the recommendations even more critical for women living in rural and regional areas.
Yeah, and just finally, what were some of the recommendations that you'd like to see implemented? What are some of the changes that you'd like to see as a result of this report?
Well, we need to start at the very beginning, and that means that medical research needs to include considerations of sex and gender, because that is the basis for care that clinicians are practising around and the way that the system operates. So we need to make sure that medical research is fair in the way it's conducted. Another really important call from this recommendation is to make sure that GPs have adequate time to provide consultations for women that experiencing chronic conditions and chronic pain. And so Women's Health Victoria is calling for a review of time-tiered Medicare funding to make sure that longer consults are adequately funded. And lastly, we know that priority populations, so people living in rural areas, people that may not speak English, people that are experiencing additional barriers to care, have more difficulty accessing healthcare. And so we're calling for system navigation and support to provide health information and referral for women to access the right health services.